Welcome, everyone. Thank you for joining us today. My name is Mark Bautis, and over the next 30 minutes or so, we're going to talk about some of the things you need to know about healthcare when planning for retirement, and specifically about Medicare. Okay, let's begin with the most basic of basics. What is Medicare? So it's a national health program for people 65 and older, administered by the Centers for Medicare and Medicaid Services, and enrollment is through Social Security. Everyone over age 65 is eligible for Medicare. This includes all US citizens and legal residents who've lived in the US continuously for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits. However, our discussion today, it'll pertain to the first group of people, those who are over age 65. So Medicare is divided up into 4 parts. Part A covers the part of the cost of hospitalizations. Part B covers part of the cost of medical services, such as doctor visits, procedures, and diagnostic tests. The bills for Part A and B are paid by Medicare. Part C and D and that's where the private insurance comes in. So Part C is an alternative way to get Medicare. And this is a way you can sign up for a Medicare Advantage plan offered by a private insurer and get all of your services under Part A and B, and usually prescription drug coverage as well through that plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company, offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan's responsible for managing and coordinating that care, your care. Part D is a prescription drug coverage. It's offered by private insurers who contract with Medicare. So each prescription drug plan is slightly different, which is why you want to shop carefully for your drug plan. And even if you don't take any prescription drugs when you first go on to Medicare, you'll want to sign up for a Part D drug plan, because if you go without drug coverage for very long, there's a penalty when you finally do enroll. So we'll talk a little bit about that, but you have to. It's something that you do want to consider when you enroll. Okay, so this image shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Parts A and B, then you decide if you want prescription drug coverage under Part D. This image shows that drug coverage is optional, but like I said, it can be dangerous to go without drug coverage. So we're recommending that everyone plan to have some kind of prescription drug coverage starting from the outset of when you sign up for Medicare. In step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional, but we think it's pretty important because Medicare leaves a lot of gaps that these additional plans or coverage fill. The second way to get Medicare is through a Medicare Advantage plan, which is offered by, like I said, a private insurance company. And there are many companies in this area offering Medicare Advantage plans. So if you go down this route, it's important to shop plans, find the one that meets your needs. And again, here drug coverage is shown as optional, but we do recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. So choosing how you take Medicare, it's a big decision. It needs to be individualized. And while we're not going to go into the complete depth of the decision today, we're going to cover some of the certain pitfalls that are out there with it. Okay, so first, we have that basic question of Medicare enrollment, which really revolves around enrolling on time. So here's some of the fundamentals around enrollment. This is the main principle: is unless you're covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. So we're gonna talk a little bit about that. What if you don't enroll in Medicare on time? So the consequence is it's pretty dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be, and it'll continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't, and you go to apply for a private insurance later, you may not be able to get insurance, or you may be charged a higher premium. Okay, if you're receiving Social Security when you turn 65, you'll automatically be enrolled in Parts A and B. If you're working and covered by an employee group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start on the first day of the month that you turn 65. Part C and D are not automatic. If you want a Medicare Advantage plan, you'll have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay with original Medicare and you have a standalone Part D prescription drug plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to proactively enroll. And you should do this at the same time that you're enrolling in Parts A and B, which is before your 65th birthday. But what if you're not receiving Social Security when you turn 65? More and more people are continuing to work or at least delaying the start of Social Security in order to receive a higher benefit. In this case, you'll want to proactively enroll in Medicare during a Medicare enrollment period. There are three main Medicare enrollment periods. The initial enrollment period applies if you're not covered by a group plan that covers 20 more employees when you turn 65. If you are covered by an employer group plan because you or your spouse is still working, you have a special enrollment period, which I'll explain in a moment. And if you miss either one of these enrollment periods, you can sign up for Medicare during the general enrollment period. So the initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. But although it lasts a total of 7 months, you really should plan to enroll in Medicare during that 3-month period before you turn 65. Because then if you do that, your Medicare coverage will start on the first day of the month that you turn 65. Otherwise, you may have a gap from when your coverage actually starts. And by the way, if your birthday happens to be on the first day of the month, everything is moved up a month. So just pretend your birthday is in the previous month. So for example, if your birthday is June 1st, your initial enrollment period would start February 1st. If you sign up during February, March, or April, your coverage would start May 1st. So we've been talking about signing up for Medicare as a whole, but there are times where you need to break it up into different parts. So most people will sign up for everything all at once, but there may be times where you'll want to sign up for some parts and maybe not others. So if you're still working when you turn 65, check with your benefits administrator to see if you should sign up for Part A. And we mentioned earlier that if you're covered by an employer group plan when you turn 65, you have that special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at 65. And the reason is that it may offer better coverage for hospitalization than your employer group plan. And Part A is usually free to you. But again, check with your benefits administrator anyway, just to make sure. If your employer group plan is a high deductible health plan, which is paired with a health savings account, and if you want to keep contributing to that health savings account, you should not sign up for Part A. The reason for this is that once you enroll in Medicare, your HSA contributions must stop. But just to be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you'll have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. So if that's the case, you don't actually have a choice. And then if you're not covered by an employer group plan when you turn 65, you'll want to sign up for Part B during your initial enrollment period, preferably that 3-month period before your 65th birthday. So if you're not working, if you're self-employed, or if you're employed by a company that has 20 or fewer employees, and that includes if you're on COBRA, or even if you're receiving retiree health benefits, you'll want to sign up for Parts A and B during your initial enrollment period. Okay, if you signed up for Parts A and B during your initial enrollment period, and if you think that you'll ever in your life want prescription drug coverage, you should enroll in Part D at that same time. If you go more than 63 days without creditable prescription drug coverage, you'll have to pay a late enrollment penalty when you finally do sign up for Part D. So it's better just to go ahead, get your drug coverage from the outset, even if you aren't currently taking any prescription drugs. As I mentioned before, you have two options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get your drug coverage through a Medicare Advantage plan. Okay, that takes care of the initial enrollment period. Now we're going to talk about that special enrollment period. So this is for people who are covered by an employer group plan that covers 20 or more employees when they turn 65. In this case, you'll not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. The best time to sign up is before your coverage ends. So that way you'll have no gaps in coverage, but you actually have a grace period of several months to avoid late enrollment penalties. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. So that's that Part D prescription drug plan. All right, to summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gaps in coverage, which is even more important, you should sign up before your coverage ends. Okay, what if no one ever told you about Medicare enrollment periods and you didn't sign up when you were supposed to? Well, you can still sign up, but now you have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you're outside your initial or special enrollment period. Coverage starts July 1st if you take this option. So you can see that can leave you with some coverage gaps, which you definitely want to avoid having. So you want to sign up under the general enrollment period as the last resort, but it may be the only option for some people. So the important thing to know is that you can't just sign up for Medicare as soon as you realize that you failed to do so. If you're outside a general enrollment period, you have to wait until the next one rolls around to do so. Okay, let's do a quick review of the Medicare enrollment periods because it's important. The initial enrollment period is for everyone age 65 who's not covered by an employer group plan that covers more than 20 employees. And the best time to sign up in this period is 3 months before your 65th birthday. And then Medicare coverage will start on the first month you turn 65. The special enrollment period is for anyone over 65 who is covered by a current worker, as a current worker, or as a spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare under this is before your coverage ends. Then your Medicare coverage will start on the first of the month of enrollment. Okay, third, the general enrollment period is for people who did not attend this presentation and did not know they need to sign up for Medicare during their initial or special enrollment periods. And they can sign up between January 1st and March 31st each year with their coverage starting July 1st. Okay, so now into the mechanics. How do you sign up for Parts A and B? It's actually pretty easy. As I mentioned, if you're already receiving Social Security when you turn 65, you'll automatically be enrolled in Medicare. If not, you can go to ssa.gov, click on Medicare, and then click on the big Apply for Medicare Benefits button. Or if you'd like to call their phone, you can call Social Security at 800-772-1213, and they can walk you through the process of doing it. Part D isn't quite as straightforward as that, because you first have to decide how you want, or what kind of prescription drug coverage you want, whether you want a standalone prescription drug plan or a Medicare Advantage plan. In either case, you'll be shopping for these plans offered by private insurers. And once you decide whether you go on original Medicare versus Medicare Advantage, and you choose that specific plan, you can enroll in Part D through the insurance company or through Medicare. So that you have the ability to enroll in Part D through the actual Medicare.gov or the SSA site. All right, so this brings us to Part 2, which is Medicare and private insurance. If you focus it on the out-of-pocket costs paid by Medicare beneficiaries, they really fall into two main categories: premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to the private insurance companies that offer those drug plans, any Medigap policies, or the Medicare Advantage plan. Out-of-pocket costs include deductibles, the portion of doctor bills not paid by Medicare, and then there's services not covered by Medicare that we'll go over. So first, let's look at monthly premiums. Part A is free if you or your spouse has paid into Medicare over 10 years. So this is one of the reasons why most people sign up for Part A when they turn 65, even if they're covered by an employer group plan. It doesn't cost anything. Part B is different though. It costs $148.50 per month in 2021. The Part B premium is adjusted for inflation, so it might be higher next year. Also, higher income beneficiaries will pay more. The Part B premium is paid to Medicare. Part D premiums vary depending upon which plan you choose. And the Part D premium is paid to the private insurance company whose drug plan you choose, not to Medicare. All right, so this table here, it shows the Part D and Part B premiums and where they fall with varying income levels. So if you're single and your income is under $88,000, or if you're married and your income is under $176,000, you'll pay that regular Part B premium of $148.50 per month. There'll be no income-related adjustment. Your Part D premium will vary But if you pick a plan that charges the average premium, you'll pay about $40 a month for a total cost of $188.50 per month for parts B and D. If your income falls into one of these other tiers, you'll pay an income-related adjustment on top of that base premium. So for example, if you're in the second tier, you'll pay an extra $59.40 for Part B and $12.30 for Part D on top of those regular premiums that we just talked about, which would bring your total premium up to $260.20 per month. So keep in mind, these are per person. So if you're a couple, you can double these amounts. Your tax return from 2 years ago is used to determine this income-related adjustment. So most people have heard of it. It's called IRMA. So as an example, the adjustment for 2021 would be based on the income reported on your 2019 tax return. And keep in mind here that the premiums shown do not include premiums for Medicare Advantage or any Medicare supplement plans. This is only for parts B and D. In addition to the premiums, there'll be some other out-of-pocket costs for Medicare. If you have to be hospitalized, the first $1,484 in hospital costs will come out of your own pocket before Medicare starts paying. Some private insurance plans cover this, which we'll go over in a minute. The Part B deductible, it's a reasonable $203 per year. This is waived for some preventive services such as flu shots and certain screenings. And the Part D deductible, it's $445 per year under the standard Medicare design. But Part D coverage, it's a little bit complicated, as we'll see in a minute. Okay, after you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bill. So if your hospital stay exceeds 60 days, you'll be responsible for $371 per day up to the 90th day, and then $742 per day up to the 150th day. And after that, you'll pay the full cost of the hospitalization. Medicare pays the full cost of 20 days of skilled nursing care. After that, you'll pay $185.50 per day for days 21 through 100. And then if you need more than the 100 days of skilled nursing care, you'll pay the full cost there. And as for Part B, your responsibility is 20% of the Medicare approved cost. So doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than the Medicare approved amount. Doctors who do not accept assignment may charge more. If they don't charge more than the 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest. So it's that 20% plus the 15% over. And then under the standard drug plan design, the beneficiary pays a $445 deductible, then 25% of drug costs after the deductible has been paid. Then there's a small co-payment once out-of-pocket spending has been reached, which is $6,550. But like I mentioned earlier, drug plans vary widely. Some will pay more, some will require you to pay less, and it's important you to find a plan that covers the drugs that you actually do take. So some of these plans are very specific on what drugs are covered and what the cost of those drugs are. All right, so after looking at all those out-of-pocket costs that you have to pay, you might be wondering, what actually does Medicare cover? Well, it covers the first 60 days of hospitalization, minus the deductible, of course. It covers 80% of your doctor bills, and it covers some preventive services. The best reference for finding out what Medicare covers is the Medicare and You book. To get that, you can call 800-663-4227 or go to medicare.gov, and you can pull it down from there. The Medicare and You booklet, I think it's over 20 pages long, talks about what Medicare covers. There's only one page that actually talks about what it doesn't cover. And it's talking about no coverage at all. So these are things that there are no Medicare coverage at all. Some of these things you can avoid, like cosmetic surgery is optional, for example. If you never go out of the US, you don't have to worry about care delivered outside of the US. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids. These are all things that you'll have to cover yourself. And this is where private insurance comes into play. So private insurance can cover all or part of your deductibles. These hospital costs after 60 days, the 20% of doctor bills that Medicare doesn't pay, and of course, all prescription drug coverage. It's offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. So depending upon your drug plan you choose, it may cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and that catastrophic coverage period. But it won't cover all drugs. Each plan has its own list of drugs called a formulary, and it won't cover much of anything else in the donut hole. Medicare supplement insurance, which is commonly referred to as Medigap policies, these are issued by private insurance companies, and they're designed to fill the gaps that Medicare doesn't cover. So some of the things that we talked about that either has no coverage or partial coverage. And they're not affiliated with Medicare. They do have to follow certain federal and state laws, which are designed to protect you, when you're on Medicare. So Medigap insurance policies are standardized. They're identified by the letters A through N. So if you buy a plan F in California, it will offer the same benefits as plan F in New York. However, the premiums can vary considerably from company to company and from area to area. So for example, in one Florida county, the monthly premiums for plan F ranged from $192 to $465 per month for the exact same policy. That's why it's really important for you to carefully evaluate Medigap insurance and not pay too much for it. We don't really have time to go into depth on all the plans here, but it's definitely something that you want to research to determine which Medigap policy works for you. And if you'd like, I can help you with going through the different and how you should do the analysis on this, or I can even direct you to a professional who can help out as well. All right, now we're on to Medicare Advantage plans, which these are also called Part C, and these are offered through private insurance companies that contract with Medicare. So the way these work is Medicare pays an amount to the plan for each member's care, and then the plan's responsible for providing the care. You may have to use the network's doctors or hospitals, and you'll want a plan that includes prescription drug coverage. With these types of plans, you may be able to get the extra benefits like vision or dental, but the benefits of and the cost sharing for these Medicare Advantage plans, they're different from the original Medicare. So again, you want to shop carefully and choose a plan that fits your needs. Okay, this is just a reminder once again, and I've said it multiple times, but it's really important to shop for these private insurance plans. Medigap policies are standardized, but the premiums vary considerably. First, the way to approach it is first you want to choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Second, you want to choose a reputable company offering that policy at the lowest price. And then before signing up, check with your provider's billing department to make sure that they process the billing for the company that you choose. Otherwise, you'll have to pay the bills yourself and then file a claim to get reimbursed by the insurance company, which is a pain. You probably don't want to do that. Drug plan benefits vary considerably. If you don't take any prescription drugs currently, you can choose the cheapest plan available and always switch to a more comprehensive plan later. If you do take prescription drugs, you'll want to examine each plan's drug list to see what kind of coverage is provided for the medicines that you do take. And the same with the Medicare Advantage plan. Evaluate each plan's offerings, costs, and then make a choice about which private insurance company to go with. Okay, as we wrap up, we're going to talk briefly about overall healthcare costs. And I'm not going to get into the weeds here, but if you if you want to have a realistic understanding of the challenges of building a retirement healthcare budget, there's some basics that we need to go over. So what can cause your healthcare budget to change, during retirement? So two things: inflation and the possibility of getting sick. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself, they get more expensive. If you get sick, you may need more expensive prescription drugs, and you have to spend, so much of that to find yourself. Having to pay many thousands. You don't want to be in what's called a donut hole, where you don't have coverage and you wind up having to pay thousands of dollars a year for your medications. And then there's always the possibility that as you age, you'll require more non-covered services like major dental work, hearing aids, or long-term care. So how do you plan for rising healthcare costs when maybe you're on a fixed income, or maybe you put together that budget when you retire, and we know things are going to change. So one way is set aside enough funds to cover your future healthcare costs before you retire. There's a way that when we do it, we kind of factor that in, or factor in healthcare inflation into that. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund all of their future healthcare costs. These are out-of-pocket healthcare costs. And that's not including long-term care, which is a whole nother animal in itself that needs to be addressed. And what Fidelity came up with in their study is that the average couple will need about $295,000 to cover their out-of-pocket healthcare costs in retirement. The Employee Benefit Research Institute did a similar study with slightly different variables and came up with $130,000 for men and $146,000 for women are needed. So it kind of comes up to that same. Theirs was $270,000. Again, these are just averages. If you live longer than the average life expectancy, or if you have different healthcare needs, you might need more. And then remember, again, these do not include long-term care, which is something to really address on its own as well. All right. So we'll talk a little bit about long-term care. And we're not necessarily talking about nursing home care. Long-term care can range from someone coming to the home a few hours a week to help with meal preparation to skilled nursing care. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all for this. So how much does long-term care cost? Well, it varies with the type of care, of course. The Genworth annual cost of care survey shows that the median cost across the United States for homemaker services cost about $147 a day, and home health aid services are about $150 per day. Adult daycare costs about $74 per day, but it really runs a wide range, anywhere from $30 to $160 per day. Residents in an assisted living facility, that can range anywhere from $3,000 to $7 per month, depending upon the location and the amenities. And the most expensive type of care, which is nursing home, where residents can get skilled nursing care, a private room ranges from $200 a day to $1,200 a day, where the median rate is about $290. So you can see at these rates, you can get well over into $100,000 a year of cost for skilled nursing care. So none of us want to get old. None of us want to think about needing long-term care, but there's some compelling reasons why you might want to that you need to get it, and think about, how am I going to pay for it? One reason you want to think about it is to spare your kids or other family members the burden of taking care of you. They may not mind doing your shopping, or they may be able to do your shopping, pay your bills, but if you need constant supervision or help with bathing and dressing, that may be beyond what they're able to do. So it's something to, another reason to plan for long-term care is to avoid having to spend down your assets in order to qualify for Medicaid. So Medicaid is a state-run welfare program that will pay for your long-term care if you don't have any money. But that's the point. You have to spend down assets to less than $2,000 in order to qualify, which essentially leaves yourself destitute. And people on Medicaid don't have a lot of choices about the kind of care they receive. So it's another reason to plan for your own long-term care, which is to be able to direct your care and obtain the kind and quality of care that you want. And when you're paying for it out of funds that you've set aside for this purpose, or when you have insurance that's paying for it, you can decide how you'll be cared for, whether it's in your own home or assisted living facility of your choice. All right, there's a lot more to say about planning for long-term care, but we're almost done here. So I'm going to leave you with 3 reminders that relate back to the 3 key points I talked about at the beginning of this presentation. So reminder number 1 is to enroll in Medicare on time. Know which enrollment period applies to you, whether you need to sign up at age 65 or can wait until your employer group coverage ends, and enroll when you need to in order to avoid those penalties and coverage gaps. All right, reminder number 2, shop carefully for private insurance to go with Medicare. Evaluate all your options, choose the drug plan, Medigap policy, or Medicare Advantage plan that offers the coverage you need at a price that makes sense or that you can afford. So you don't want to be someone that pays too much for private insurance because they didn't know any better. Open enrollment is October 15th to December 7th, and that's where you can make changes to your Medicare coverage. So I know earlier we talked about the 3 periods of signing up for Medicare, but you also have the ability each year to make changes to the plan that you currently have. And then finally, plan now for higher healthcare costs in retirement. We know that healthcare expenses will be higher tomorrow than they are today. So when you're planning your retirement, figuring out how much savings you'll need to make your money last, be sure to make sure you factor an extra amount for healthcare. You'll definitely be glad that you did take that time to factor that into the analysis. All right, so that brings us to the end. This is one of our webinars. We're committed to putting on educational events like this. I think we've done over 15 this year, and we have plans to continue into next year as well. Our next webinar is a continuation on this topic. So that talks about transitioning to Medicare from your employer health insurance. and what the gotchas are with that and how to go, what the process is for doing that. We have a learning center on our website where we have the ability to register for future webinars, also webinar replays of all of the ones we've done. And we have some really great topics where we talk about estate planning, Social Security, retirement planning, how to build a budget in retirement. So if you're looking to find out more information, it's definitely a place where you can go to get some of that. But if you still have questions, you're more than welcome to set up a free consultation from my website again, bautisfinancial.com/call. I'll take some questions now if we have any, but otherwise, some of them may be individualized, and it may be better. You may feel more comfortable setting up a call to go over those. So, Kira, is there anything we have now to any questions we have?
The question is, I understand that a person age 65 who has either filed or is filing for Social Security will automatically be enrolled in Medicare. However, assuming they qualify for the exemption of being on a group plan with 20 or more employees and do not want to enroll at this time, they would proactively decline Medicare. What is the process to proactively decline Medicare?
Okay, so if they're filing for Social Security after age 65, they can decline Part B at the time that they file for Social Security. If they're already receiving Social Security when they turn 65, they'll automatically be enrolled in Parts A and B. However, what's going to happen is you're going to get a packet from Medicare, and in that packet, it's going to in the mail, it's going to come in that packet. Instructions will be included on how to decline Part B. So you just have to look for that packet, and you'll be able to decline Part B through there. Part A is mandatory for anyone receiving Social Security. So if you're over 65 receiving Social Security, there's no option to decline. But again, that's that free part of the coverage. Okay, so thank you everyone again for joining us, and hopefully we'll see you on the next webinar that we host.